there is no one way. This path is a up and down, over and under, backwards, 2 steps forward, 4 steps back journey. And each person's path is unique to their own unique cancer, their unique body, their unique mental health. There is no one right way to do this. It is very unique to each individual.
Welcome to the Erie Wellness Podcast, your go-to source for all things health, wellness, and living your best life right here in Erie. I'm your host, Lauren Brunetti, and I'm so excited to have you here. Each episode will dive into conversations with local experts and wellness professionals who are making an impact in the world of health and well-being. Before we jump in, be sure to like, share, and comment on this episode. We love hearing from you and seeing our community grow. Now let's get started. Hi, friends, and welcome back to the Erie Wellness Podcast. Today's conversation is one that really opened my eyes, and I think it will for you too. I had no idea that services like this even existed, and I absolutely love what today's guest is doing, not just for patients, but for their entire families. I'm so honored to introduce you to Megan Graves. She's the founder of Beacon RN, a personalized breast cancer education and navigation service that offers the kind of support we all wish we had in our most vulnerable moments, someone who feels like the nurse in the family. With over 20 years of experience in nursing, spanning everything from neonatal care to breast surgery and oncology, Megan brings not only deep clinical expertise, but an incredible amount of heart to the work she does. She's also a certified breast care nurse and certified lymphedema therapist, and she works virtually with individuals and families across the country. If you or someone you love is walking through a cancer diagnosis or even just wants to better understand how to support someone who is, this episode is for you. So welcome, Megan. Can you start by sharing how you started Beacon RN and what led you to become a breast cancer nurse navigator?
Yeah, definitely. Beacon RN was really the product of my heart and a product of my own experiences with having been a nurse navigator for 8 years and having been a nurse for 25 years. I had been with our littlest of babies starting out when I was really young, the NICU and the pediatrics. And then I moved into the breast cancer world. And when I moved into the breast cancer world, I kind of found my passion and my place that I thought, oh, this is really what I'm going to do with life. And I really want to be here to walk beside people along this journey. Mm-hmm. But my personal story was that I had already worked as a breast surgery educator. I had already developed a surgery program. I had run that program and become like the person for these women and men who had breast cancer. Mm-hmm. And I had helped them through the whole process and helped them transition through the whole process. And then through a series of pivots in life, I ended up leaving the surgery part of it and going into more the medical oncology and working in the chemotherapy and infusion department and the immunotherapy department. Mm-hmm. And I was working there, still being with my breast cancer patients, but being with them in a different way. And when my dad was diagnosed with liver cancer, I went home, or I was trying to manage being home in Wisconsin and here in Colorado, trying to navigate and manage his cancer diagnosis and manage my mom and her fear and overwhelm and concern for my dad, and just not knowing the cancer world, not knowing the medical field in general. What I found is that they never went to the doctors. They never were part of the healthcare system. They didn't understand the words. They didn't understand the language. They didn't understand all the appointments. And I was trying to manage this from afar. And also go back there and be their support and their navigator and their advocate and help them get through this.
Mm-hmm.
So I had never really thought of doing my own business, or I had thought of making something like Beacon RN until I saw how hard this is on families and how hard it is on not only the person going through the cancer diagnosis, but the entire family.
Mm-hmm.
So when my dad passed away, and we were all grieving and going through this process, I kept thinking, I've done this for so many of my family members. I've walked this path with my grandmother, my grandfather, my dad, my mother-in-law, an aunt, numerous aunts, and I was their nurse in the family. And I just kept thinking, this is what I want to do. This is how I want to show up in the world. And this is how I want to show my passion and help people get through this just a tiny bit easier, just make it a little bit easier for them to navigate this entire overwhelming process.
Well, Megan, that is really a truly inspiring story. And I love how you took your story and your passion and really have put it into a purpose-driven business for yourself. What I love about your particular practice is that you really, you have your patient that's going through this and experiencing all of it, but then you also have their caretakers, which is most likely spouse, children, and you have developed these different classes and resources to both support the patients and the caregivers, because all of this is overwhelming for everyone. So can you tell us more about what you offer and how someone can get connected?
I think I'm going to kind of start with what classes I teach, and are the caregivers part of that?
Okay.
Definitely the caregivers are part of every step of this process. You cannot do this alone, and we don't want you doing it alone. The more people you have in your corner, the more supports you have, the better. So I love having caregivers there to be part of all the classes that I give, and I actually recommend it and ask for them to be there. I teach my classes virtually via Zoom, or I do them in person if it's local here in Colorado. I go and meet you at your house, and I have your whole family there. I just recently taught a breast surgery class to a mom, her 3 children, her sister, her best friend, and the dogs were even there. They weren't listening, but they were there. And, the kids were there and they were part of it. So I teach you with the breast surgery class how to prepare your body for it ahead of time, what surgery is going to look like on the day of, who are all the people you're going to talk to, how are you going to prep, how are you going to care for yourself right after surgery, how can your caregivers help you? And we talk about the lymphatic system. We talk about how to decrease your risk for lymphedema. And all of that is taught to the whole family. Because when you finish with breast surgery, there's things you're going to be able to do and there's things you're not going to be able to do. And you're going to need help and support. You're going to need help with your medications and remembering what to take when. You're going to need help with things like vacuuming and cleaning the house and, walking the dogs and things like that. So that's where you can get all those caregivers involved and say, this is how you can help. This is how you can be part of this process and make this a little bit easier for your loved one and for your mom. So.
You've mentioned the lymphatic system a couple of times. And for listeners that don't know the importance of the lymphatic system during this breast cancer journey, can you explain why you're kind of focused in on that system?
Yeah, definitely. The lymphatic system is a huge system that we don't talk about much or think about much. Our lymphatic system is comprised of our lymph nodes, our lymph vessels, our organs, like our spleen. And it's really a big part of our immune system. Our lymphatic system helps to catch cancers and eradicate them, kind of get rid of them. It helps to fight against infections, bacterial and viral infections. And it's really kind of our garbage system for our body. It gets all these toxins and wastes and it removes them from our body. So it is a big part of our breast tissue and a big part of breast surgery, because when we do breast surgery, and let's say we do a mastectomy and we do what's called a sentinel lymph node biopsy, which is meaning it's the first lymph node in the chain that drains the breast. So it's where the cancer would spread to first if it was going to leave the breast and go into the lymph nodes. When we do that surgery, we do remove lymph nodes. And when we remove lymph nodes, they can't do their job as well as they did before. So that puts us at a higher risk for infection and for edema. So when we say lymphedema, edema is when fluid can't leave the chest or leave the arm. And so you get swelling in the arm and the chest, and that swelling can become permanent if it's not managed and taken care of well and it's not treated. So our goals are to reduce the risk for that swelling occurring and to help the body heal when we remove those lymph nodes.
Okay. Thank you for explaining that. I feel like that helped me a little bit, and hopefully it helps some of the listeners that just weren't sure about that.
Yeah,
so
it's a big word.
One thing that really stands out about your approach is obviously, like I mentioned, it's supporting those caregivers. So in terms of like, what advice do you give to loved ones who want to help, but they feel overwhelmed themselves? And what can caregivers do to stay emotionally grounded so they can show up the way that they want to for their person?
This is another one of those topics. Like, I could have just talked to you for an hour on lymphedema and the lymphatic system. This is another one I could talk to you about for hours. The advice I really give to the whole family is, and that's, partners, children, parents, is really stay for the hard. This is hard. Breast cancer is a long journey. It's a tough journey. Many times we don't see the person, our loved one, doesn't look sick. They aren't sick. They weren't sick. Before they got cancer, they were not sick. And they are still not sick. But because they have cancer, a lot of the treatments and the surgeries and everything is going to make them not feel like themselves and is going to make them have to go through the process of being a patient and being sick. So stay for the hard, because cancer is hard and cancer is isolating just in and of itself. It's extremely isolating to the person going through it. They need to find support within the breast cancer community for themselves. And I think it's really important for the family to find support within the caregiver breast cancer community, because they need people who understand and who have been down this path. Acknowledge for the caregivers, acknowledging your own fears, worries, and anxieties. We are just as scared for our family member. When my dad got diagnosed with cancer, it was overwhelming for my mom. She couldn't even imagine how she was going to help him get through that. But she kept just denying and kind of putting it, like stuffing it down, right? Because we can't deal with that. We have to just deal with helping them. But if we don't deal with our own emotions and our own fears and our own worries and anxieties, we're not really good to somebody else.
Right.
So acknowledge those fears, acknowledge the worries and anxieties, and just listen. Just don't try to fix, don't give advice, just listen. And many times just sit and be present and say, I have no words. I don't know what to say. It's better to say nothing than to say something that's hurtful, or is not validating. So just listen, be present, and just have small, simple steps to be present in the moment and not try to look too far ahead. Don't try to take on and fix everything all at once, because you can't do that. Very small, tiny little chunks of information and very small, tiny little chunks of data at each given time. If you're going to go out and research, because many partners, I find they want to go out and collect all the research, collect everything they can to try to find the cure and find the fix, and how are we going to get this taken care of the best way possible. And I think that's great. It's nice to have somebody who can do that for you. I do that for my clients often, but a lot of times partners want to do that. If you're going to be that person, that gatherer and that data collector, make sure you're going out to reputable websites. Make sure you're not going down rabbit holes of really, really scary things that don't have anything to do with your cancer. Know what you're talking about. Know the data. Know all the specifics of your cancer before you go out and start researching. So you're not getting overwhelmed by all the things that don't really relate to you. I think it's great to make a binder or a simple, very like an organizer that can collect cards from the doctors and from the nurses and from all the caregivers that you're going to be seeing. Compile their phone numbers, their the different my charts and the different portals, so that it's all at the tips of their fingers. These are all things I do, but these are things I put to the caregivers to do also, because it helps them have something to do.
Yeah.
And for the caregivers, accept help. Be willing to ask for help and be willing to accept help. Tell people very succinctly, very simply what you need. If somebody says to you, tell me what you need, or I'll do anything, just call me. Right then and there, tell them what you need and tell them very specifically, because I think that's a gift for all of us that are just trying to help. I think if you can just tell somebody, you know what, I need dinner on this night, and I'd like you to go pick up Chipotle for us, and I'd like you to have it here at 6:00. For me, as the helper, I'm like, thank you, done, got it, take care of. But just this offer of help that nobody knows what to do cannot be very helpful for the caregivers. Like the caregivers and the patient need to be able to be very specific. I think gift certificates and for services, something like a gift certificate to have Beacon RN be your nurse navigator and be your personal advocate would be a wonderful thing to give to somebody. But gift certificates for housekeeping, for massage, for acupuncture, for supplements, for organic food delivery services, anything like that you can give that they can then utilize when they need it. That helps support both the caregiver and that helps the patient themselves or the client.
Well, Megan, all of that was pure gold. That was so good. And there's so many things going on behind the scenes, not only in the patient's minds, but the caregiver's minds, and just everyone wanting to try and find these solutions. But I appreciate your honesty and ways that people can really help, and how you can be present, and just how everyone can be the healthiest they can be as they're going through this whole entire process. So let's talk a little bit about staying well during your treatment. So you mentioned like organic food service. So from nutrition, exercise, detox, acupuncture, how can women support their bodies during such an intense time?
Yeah, that is another huge topic, right? And I'm just going to touch on a couple little things. And I always want to go back to this small steps, tiny little things that we can do that make big impact. Because cancer is overwhelming. This diagnosis is overwhelming. And what I see many times is people thinking, oh my gosh, I got diagnosed with cancer. I'm going to change everything. I'm going to change my whole life. Everything's going to stop. Everything's going to become different. Mm-hmm. That's too much. That paralyzes us when we do that. So things we can do to stay well are just simple, small things, small steps, small modifications. The number one thing we can do for our bodies is increase our exercise. Get out in nature, get out and move our bodies. It has been proven and shown time and time again that while going through chemotherapy, walking, just getting outside and walking for 15 minutes a day, or 15 minutes 3 times a day, or 5 minutes 5 times a day, whatever you can do, even if it's just walking around your house, walking up and down the stairs, it's that exercise really just helps our body to process the fatigue. It helps us to detoxify. It helps us get those chemicals out of our system. If you can try to minimize our intake of toxins into our body. And that comes from things like we can cut down on our alcohol consumption. We can eat organic foods instead of foods that might have pesticides on them. A great resource is the Environmental Working Group, to go out to their website and find the Clean 15 and the Dirty Dozen. Mm-hmm. Just making those small choices. And I don't know if your readers know or your listeners know about the Clean 15 and the Dirty Dozen, but this is for all of us all the time. Trying to choose those fruits and vegetables that are not heavily laden with chemicals and pesticides. So the Dirty Dozen are the ones that show that they absorb more of those toxins from the ground and from the chemicals and pesticides that are used on them. Whereas the Clean 15 are things that you can eat that they don't have to be organic. They don't absorb the same way as the Dirty Dozen does. So going out to the EWG and looking at what products they recommend or don't recommend, what we put on our body for beauty care products is another step. We can choose things that are clean beauty products instead of things that have toxins and chemicals in them that are endocrine disruptors, or they change kind of how our hormone system works. Mm-hmm. Those would be the things I would start with. And then we could get into detox baths and acupuncture and nutrition. I always recommend the Mediterranean diet for all of us. That's not just for people going through cancer, but, trying to eat more whole foods instead of the processed foods. Just that alone is a big key.
Mm-hmm. As you were talking, I was thinking, we hear all of these things, just even if you're not going through breast cancer or a cancer diagnosis, but, consistency. It's not, you don't have to get in really super long workouts, but it's a consistency in the things you're doing, the little things you're doing every day that add up to more momentum and, greater health outcomes.
Even just, I put down a few small lifestyle shifts that I think make a huge difference for all of us, but things, especially when going through cancer, if you want me to, if we have time to kind of step into that just a little bit.
Yes, please. Yeah, I'd love to hear, especially I love talking about clean beauty products and all those kinds of things as well.
Oh my goodness, I could talk about clean beauty products for days on end. I am a huge proponent of that. Our skin is our biggest organ, and what we put on it makes all the difference in the world. So trying to just keep simple ingredients. It's kind of like our food that we put in our body, simple, whole ingredients. The more simple, whole products we put on our body and in our body, the better we're going to do. Mm-hmm. But a few of the small little shifts that I like to talk about is drinking clean filtered water, and lots of it. At minimum 64 ounces a day to flush toxins out of our body. Mm-hmm. Pooping a minimum of 1 time per day. If we are constipated and we are leaving that food sitting in our system, it's just leaching out into our gut and leaching out into our bloodstream. So we want to be pooping a minimum 1 time a day. We want to be peeing a minimum of 6 to 8 times a day. Our pee should be almost clear yellow. You should almost not be able to tell the difference from the toilet water when you pee, because then you're super hydrated and you know that. Minimizing those environmental or ingested toxins, exercising, and then breathing and mindfulness. It seems simple and it seems kind of boring, but just doing some, meditation apps or some mindfulness techniques prior to you getting up and getting out of bed in the morning or right before you go to bed at night will help with your sleep. Mm-hmm. And sleep is the other huge important piece, because our bodies all start to heal and process our days when we're sleeping. So the more we can keep our phones out of our bedrooms, keep TVs out of our bedrooms, keep that blue light out, and really take the time to have good sleep hygiene. And I know that's like a big buzzword right now, but really that is when our bodies rejuvenate, and we need that sleep for our minds and our bodies.
I know, Megan, I would love to go down each of those rabbit holes with you and talk about all of those different areas, but thank you for highlighting all of those just small, simple lifestyle shifts that tend to make a difference, especially for those people that are going through breast cancer. What is the number of people that are roughly diagnosed with breast cancer every single year?
It's kind of, the number I can give you that's an easy number to understand is about 1 in 8 women are diagnosed with breast cancer every year. Mm-hmm. And over their lifetime. Here in the Colorado, especially the Denver metro area, our numbers tend to be a little bit higher. I see 1 in 7. Mm-hmm. And I don't really know why that is, but there is definitely some idea that it could be due to some of our environmental toxins here. So
very interesting. Speaking of like local things going on, you're also involved in It's Roberta's Legacy and J. Will Pink Village, which are both amazing local organizations. Can you tell us about the work they do and how people can support or get involved in those two?
Yeah, definitely. Roberta's Legacy is a wonderful group. It was started by Amy Willard, who is, she lives in Erie. Her mother had metastatic breast cancer and passed away a few years ago. And she wanted to give back to the community. And Roberta, who is Amy's mother, wanted to help others with breast cancer. And they decided that they would start this foundation so that they could help women going through breast cancer. The great and amazing work that they do is all foundation. It's all funded through donations and through their foundation. What makes them unique is that they bring in donations, and 100% of the donations that come in go right back out to women with breast cancer and to help their families and them through this process. but they don't ask for much for their qualifications to be able to be a recipient of their donations. Their qualifications are: you need to live in the Erie St. Vrain School District. You need to have had breast cancer and have a note and a letter from your doctor saying that you are in active treatment for breast cancer.
Mm-hmm.
And they will then help you fund things like your mortgage or food for you and your family, or they have different events for kids to come at Christmas time or at Thanksgiving, and they give the whole Thanksgiving meal away.
Mm-hmm.
So they have just such a wonderful program, and they are really helping people right where they need it, when they need it, to get the support and resources they need so that they can pay their electric bill, so that they can pay their mortgage.
Mm-hmm.
And it's just a wonderful group.
That brings up another really great point, though, is how many people are financially struggling through something like this as well, and how we can help them.
Mm-hmm. Cancer is one of the most financially toxic chronic illnesses that we see, because the medications and the treatments are so expensive. And even with insurance,
Mm-hmm.
you're still talking about hundreds of thousands of dollars for one chemotherapy treatment.
Yeah.
So even when you're just paying copays, or you're just paying, your deductible, that can be, you can meet your deductible, January 15th with your
Mm-hmm.
first chemotherapy infusion.
Mm-hmm.
And that is hard on people's pocketbooks. And then you can't work because you're not feeling well, or because you have to be off because you just had surgery. So people are really struggling, even locally, and especially locally, to be able to pay their rent or to pay their bills because they're not working,
Mm-hmm.
because they feel cruddy.
Mm-hmm.
So it's a wonderful program. And being that you're in the Erie wellness area, they're in the Erie area for a wellness program,
Mm-hmm.
I just wanted to highlight that it is for your school district. It is those people who live within your school district.
Well, thank you. I'll make sure to include a link to them in the show notes.
And then J. Will Pink Village is another organization I work with. That's a not-for-profit, and that was started by Jen Willard. They are not related, Amy and
Mm-hmm.
Jen, but they definitely work together. And Jen Willard started the J. Will Pink Village because when she had her breast surgery, she was given a heart pillow that she used in the car after surgery to protect her chest from the seatbelt,
Mm-hmm.
and to protect her chest from inadvertent hugs or bumps or the dog jumping on her. And she thought that pillow was just the most amazing thing she had ever received. And it was donated to the hospital where she had surgery. And she found out that other hospitals in the area did not have these pillows and
Mm-hmm.
did not have this kind of support. So she took it upon herself to make it her passion and mission to get these pillows into the hands of all people who are having breast surgery, so that they can have the comfort and the protection of the pillow.
Mm-hmm.
And she is local. She's out of Louisville, and she always is accepting donations. She also accepts people coming and stuffing the pillows, cutting, sewing. We've done many fundraisers in the area and locally with different corporations that want to give back to support these pillows being given out to the different hospitals and nurse navigators in the area.
Oh, that's incredible. One of my questions was, so are they handmade? Like, are you going through and are they going through and making through all of them? But it sounds like they are. So a lot of hard work and love put into those pillows.
Yeah, they are handmade, and there's a little card that is attached to each one, and it's handwritten by a survivor, telling them that somebody was thinking about them and that this was made with love and care specifically for them. So it is just everybody who gets one. And I've been so fortunate to be given these as a donation so I can give them to my clients. Everyone I send them to calls me back and tells me just how amazing it is, and that they still sleep with them, years and years later. And they're like, can we have another one? Because mine's worn out. I've been sleeping with it for 10 years. So
I love it. Well, Megan, as we wrap up here with our conversation, if a woman is listening to this right now, either newly diagnosed, in treatment, or recovering, what do you most want her to know?
Oh, goodness. You are not alone. I am here. I would love to walk this path beside you. You are not alone in that there are so many support groups and so many resources out there that I would love to be able to share those resources with you. You can go on to my website, which is beaconrn.com. And I have an entire resource page for you to go look at to see if you can find some of those support groups and some people who are walking the same path as you. Yeah, there is no one way. This path is a up and down, over and under, backwards, 2 steps forward, 4 steps back journey. And each person's path is unique to their own unique cancer, their unique body, their unique mental health. There is no one right way to do this. It is very unique to each individual. And it is a step-by-step process. It is a 1 foot in front of the other process. And some days it feels like you're standing still or going backwards. And that is normal.
Great advice. How can people find you and follow your work or reach out to you for support?
So my website is a great place to go. It's beaconrn.com. I'm also on Facebook and I'm on Instagram also. Calling me with my cell phone number, which I don't know if I want to give it out here, but it is on my website if you want to call my business number. Talking to you, and just reach out to me via text or email. I would love to talk to anybody and have a conversation about how I can help them, or if they want to give a gift card of my services, they can just reach out to me via email, and I would happily send a gift card and help their loved one on this journey in this path.
And you also do discovery calls, correct?
I do. I do a free 30-minute discovery call with anybody who would like to reach out to me and talk with me. That's just so you can understand what I do, and I can kind of get an idea of what your path is and how I can most be helpful. That is always free for a discovery call, because I want to talk to you. That's the best way for me to know if I can be of service for you.
Megan, thank you so much for sharing your heart and your expertise with us today. What you are doing through Beacon RN is such a gift, truly the kind of compassionate care and clarity that every family navigating cancer deserves. To everyone listening, if this episode touched or made you think of someone who might need this kind of support, please don't hesitate to share it. You can find Megan's services and resources at beaconrn.com, and I'll be sure to link everything in the show notes as well. Thanks again for tuning into the Erie Wellness Podcast. I'll see you next time. That's a wrap for today's episode. Thank you so much for listening to the Erie Wellness Podcast. I truly appreciate you being a part of this journey. If you loved today's conversation, don't forget to subscribe, leave a review, and share it with a friend. For more daily wellness inspiration and behind-the-scenes content, be sure to follow me on Instagram at the Erie Wellness Podcast. I can't wait to connect with you again soon.